Hello and welcome to Ethiopia. I think I might know most of the people who are joining us, but I'm so glad that you're taking some time in your morning or afternoon to join us, depending on where you are. My name is Mike Tenbush. People will introduce themselves as we speak, but we're really excited to be with three doctors from Trinity St. Joe's in Ann Arbor who are spending a week with us to provide healthcare in hopes of forging a collaboration where residents at Trinity St. Joe's can do this as a part of their rotations in the future. So very excited and grateful to Trinity St. Joe's and to you three. And we wanted to hear a little bit more about what you're experiencing. I think everybody knows our mission at International Samaritan is to walk hand in hand with people living in garbage dumps across the world to break the chains of poverty. And we usually talk about holistic scholarships to do that, but of course, health and wellness is so important. So Salam Kasai is our health and wellness expert, public health, with a master's degree in public health, and she oversees our public health and wellness efforts across all 8 communities and 7 nations. Thank you, Salam, for bringing us together.
Thank you, Mike, for coming. Thank you, our dear doctors, for coming also. Hello, everyone. My name is Salam. I'm the health and wellness specialist at International Samaritan. I'm based in Ethiopia, so I oversee the health and wellness programs here in Ethiopia and in other nations where International Samaritan is established. We're very excited to have these wonderful doctors with us. The health and wellness of our scholars and our families is very critical for them to flourish in education and overall in their overall family setup. We're very excited that we have these doctors here so that we'll see a future collaboration. I want to ask Patty how your experience has been so far, so that our guests.
Yeah, well, thank you.
I'm sorry, Patty, before you ask for that, I should have said, if you have questions, there's a bar on your computer, you can type them in. Our goal is to talk for 12 to 15 minutes so that we have another 10 to 15 minutes to answer questions. So go ahead and type them in. We'll see them, and we want to be very responsive. We want this to be a conversation.
Sure. So I'm Patty McNally. I'm an internal medicine doctor by training. I work at Trinity Health, Ann Arbor, and a large portion of my job is also to teach and oversee our internal medicine resident physicians. And so in terms of talking about our experience so far, it has been really amazing. So our very first, full day here, we really focused on meeting the team that's on the ground here, as well as getting tours at the Family Life Center, getting kind of tours of the community, and hearing some stories of the scholars. And I think what strikes me the most is just the incredible hardships that children have gone through, and yet they are so resilient to be absolutely thriving, and just the resilience of the human spirit that I've seen in our scholars and their families in this short amount of time. It's just really absolutely moving. So I think that's the thing that strikes me the most.
Yeah, I know it carries me for sure.
Yeah.
For sure. So the talk is called Behind the Stethoscope.
Yeah.
What did you hear behind the stethoscope today? What were your conversations like?
So I'm Heidi. I am a third-year resident at Trinity Health. And so today we went to 2 different kind of healthcare services that they have here. First a clinic, and then their hospital that is one of their main hospitals in Ethiopia. And from that, you get to see the wide variety of needs this country has and how we can help fill those needs. In the clinic, there were plenty of healthcare staff, plenty of people working. There was tons of patients to see, but unfortunately not as many rooms and spaces we'd like to be able to see all of those patients. Whereas when we went to the hospital, they had plenty of room. It was a very large hospital, but there was more need for more healthcare providers and kind of that education component that is so important to providing good healthcare.
Awesome. How about you, Doctor?
I would have to say one of the things, if I had to put a word that sort of left me was, seeing patients and meeting the people in the community. It was extremely unfair. These are people, and a lot of people are just born into this situation. The unfairness of it is really made an impact on me, and I would have to say the the contributions of this program, the people that are in the scholars program, the impact that it's had has been just unbelievable. I'd have to say, as a doctor, it's different as a human being. I think, like, when I walk around and I see the community service centers that they've sort of created here, the kids in the scholars program, like, there's a real sense of, like, they belong together. They're very high achieving. I don't know, every single person I've met is very high, but the families also, like, we saw a lot of the parents in the clinic today. It affects the whole family. I would have to say every single parent I saw is extremely, they also have had a very unfair background and have serious medical problems. They are very grateful for everything, but they have a sense of hope now, and I do think that that's very real. They are limited, and everything they can follow through with on all of their medicines are covered. In fact, a lot of International Samaritan contributions have helped them get better health through that way, but they can't do everything we recommend. Whenever we say you need to take a day off work because you pulled a big muscle, they're like, I cannot do that. So we find a ways, to work through that and work around it with them. But I would have to say that was probably some of the biggest, the hope and the sort of sense of community that has created. Every single family member I saw, they all know each other. They know Salam. They see each other around town. They just really know each other well. It's a really, it's real. It's not fake. It's a real, like, sense of belonging that they have.
And I'm just curious, what were the people you saw, like, if you see 20 people in a day in your practice back home, and you saw 20 today, what kind of differences were presenting today?
Yeah, well, there were differences, I would say, in how much support that people have, how much people know about their health problems, and really what medicines and what treatments are available to kind of help them manage those diseases. In the United States, unfortunately, we've gotten very good at taking care of chronic illnesses and managing these chronic illnesses. And I don't think that, I think that unfortunately chronic illnesses are on the rise here, but I think it's a little bit harder culturally to be in the mindset of thinking about managing the chronic diseases and obtaining the medications that you need. Some of the patients had been here and would be put on a short course of a medication. Really, they might need something for a really long period of time to help control their diseases. So that's, I think, some of the things that I had seen here that's probably in evolution in the healthcare system here.
Yeah, that's what I had to that.
I would say, to that point, a lot of the diseases and conditions that I saw today were more because they just hadn't followed up with the doctor. They didn't either feel the need or didn't have the time or didn't have the resources to come see a doctor. That are things that in the United States, you'd make an appointment and be at the doctor's office the next day to get that treated and worked up. And so because they don't have those resources to get things treated as quickly or seen by a doctor as quickly, they tend to have progressed further in their disease than what we would normally see in the United States.
Trinity, we're able to send residents in the future to do rotations. What would you be hoping for the residents, and maybe what would you hope for the community if this collaboration were to be able to grow and be successful?
Well, we certainly have a bunch of residency programs that would fit a bunch of attendings in different fields that would love to probably also help out. But our residents would learn a ton. They would learn a lot about perspective about the world and what the way the world is and the way people's health is around the world. They would learn about a bunch of diseases that they don't know. But really, our goal is to figure out a way that it's mutually beneficial, that it's equally beneficial to the health system here. We want to find the places where we can add. We don't want to slow them down. We want to increase their speed. We want to increase their ability to learn new things. We want to increase their ability to raise the bar on academics and see more patients. And so the whole goal would be to find something that helps both sides really a lot.
And I was struck by when we met with the Alert Hospital leadership, they're very forward thinking of wanting to be kind of a leader in graduate medical education by 2030 is one of their goals. And I was really struck by that they already are a tertiary care center where they have people from all over Ethiopia coming here. But they see excellent clinical care and really taking care of, of patients who have unique needs, and being a major educator are part of their goals. And so I was just really struck by how there are actually a lot of similarities in their mission and our kind of Trinity Health Ann Arbor mission as well.
For our community, for this Kore community, so they're under the Alert Hospital, and Alert Hospital's mission and vision is to help out those poor communities like International Samaritan and that. So for the Trinity Hospital to bring in more doctors, it means for our communities to get more medical attention. So for the patients that these doctors see today, like these patients, they don't see doctors for like 5 minutes. They get into an OPD or the inpatient, the outpatient department, and they leave right away. Nobody gives you the attention and the time that is needed. So for this doctor to come in and fill in the gap will mean so much. And Alert Hospital and the clinic, they predominantly help out this community. They are for this community. So I see a shared goal. Yes.
And so we have 900 scholars or students across the world in communities around garbage dumps. And out of those 900, this year we have 20 in some form of medical school, either becoming doctors or nurses. We have nutritionists in Nicaragua, and we have a pharmacist in Ethiopia. Sandra Wheat is that pharmacist. So we wanted to hear a little bit from you, because our goal is to build the medical field here in each community. And that's what Trinity is helping us to do, is strengthen the systems that are networks over here. Tell us a little bit about your story.
Okay.
No.
Okay, my name is Tamrawit Omay. I am 22 years old. Before I joined this program in International Samaritan, here is the education center, me and my family, our story, our family status was not very good. Today, I'm sitting here in front of all you guys just to be a witness of International Samaritan. And this health and education center did a lot of things in my life, starting from education, health, feeding, in recreational purpose, and so many things. I have got so many supports here. And right now I am surgery pharmacy student at St. Lideta Mariam Health and Science College. I have extra shoes and clothes to change. And I'm very happy to be in front of you guys. Thank you very much.
Thank you. What was it like before you became a scholar? Talk a little bit about what it's like.
It's before 4 years. I joined this scholarship program. The way I joined this scholarship program is like my mother's work was collecting dirt from people's house. When she was collecting these people's dirt from their house, she got Salamti, the older one.
Yeah.
So when she got Salam, she talks about her story. Yeah, my mother raised us without a father. Our father was not in our family. When my mother gave birth, he left her alone because the pregnancy was unexpected, and the pregnancy became twin. It was a very shocking story. So
Twins, the pregnancy was twins.
Yes, she has a twin brother.
and our story was, our life was very difficult. Then after, my mom told us everything about our life, our hustle, our struggle. Then after, Salamti, she heard all about our story. Then after, when we score high, by taking our result, she promised us to give educational support for college and for university. So me and my twin brother, joined Hausa University. After joining that program, he became a student of law. Right now, he's the first 5th year law student at Hausa University. the story in our life was very difficult to tell. It's simple to talk right now, but our past life was very difficult. We raising six, we are six in our family member. We are six. I have two brothers, two sisters, and my twin brother. And my mom raised us without any help. We don't even taste what fatherhood look like. She raised by her own self. Right now, by joining this program, she stopped working collecting dirt and she started boiling coffee and tea around Mabratay. And we are really very happy because of International Samaritan.
Thank you.
Shout out to your brother Dawi, who will be one of the first lawyers graduating as an International Samaritan scholar, and we have one in Guatemala. First in Ethiopia, as well as a doctor.
And he also has published his first poetry book.
Oh, wow.
He writes poetry and then he has a book out with the help of International Samaritan. Yes. Okay, so do we see questions?
Yeah, question for you, Salam. Do you see any major differences in healthcare needs here in Ethiopia compared to the other countries in which we work in International Samaritan works?
Okay, so they look similar. The problems here in Ethiopia and in other countries where International Samaritan is based. So more or less, they are developing countries, right? We are set up in Central America and in Africa and East Africa. So they are similar. The health problems are similar. The health system setup is similar. But I can testify that when it comes to Ethiopia, it's more because of the population size. With like over 110 million people, there is scarcity in health providers, and even the structure is very poor. But all in all, it's similar, especially in cases like there are communicable diseases here, there are communicable diseases in Central America where we're set up, and in East Africa, in Kenya and Uganda. There are non-communicable diseases like hypertension and diabetes and cardiac cases. They're rising up like it is now. And also there are injuries and traffic accidents and traumas which are prevalent now. And plus mental health issues are rising. And it seems like in each country it looks similar. So I would say we share common problems. Yes.
Thank you. Next question is for Samra.
Okay.
What's the most interesting thing you've learned in your pharmacy study so far?
In my pharmacy study?
Yes.
Health service management.
What's that mean? Talk.
Health service management means giving service for patients who just want to take a medicine or any kind of medicine means like medicine.
Yeah.
So giving the service for those patients is very interesting as it's like giving humanitarian service.
Mhm.
Like you can feel their pain also when you give them medication, when you prescribe the medication for them,
Yeah.
giving like the medicine for them, you can even feel their pain when they told you. So health service management is a study which is study about it's like a course. When I studied here, I was very interested in that, like taking care of others.
Okay.
So a couple of kind of funny stories that happened today, at least from my perspective. One is when Dr. John was interviewing everybody, he kept saying, man, this guy hasn't been seen by a doctor in 7 years. This woman hasn't been seen by a doctor in 8 years. And he couldn't figure out why there are these large gaps in how long it's been. Because that's my fault. I forgot to share with them that Ethiopia is on the original calendar system, the one that didn't get corrected by Pope Gregory. So it's 2016 in Ethiopia. So he kept seeing records that said last seen 2015. And he's like, that's 8 years ago. So we fixed the healthcare system. We got everything. And then
7 years.
7 years behind.
Behind.
Yeah.
Yes, our calendar is 7 years behind. We got that straight.
And then, I also thought it was funny. What is the average age of the person you saw today?
We don't know.
Yeah, so I saw about 80% of my patients said they were 35 today. And I would say probably about 15% of them were actually 35. So it was quite a, we guessed what age we are.
It turns out a lot of people guess how old they are here. They don't know the exact,
Birthday.
and a lot of people guess 35. And so,
Or they round to the decade. When they're in their 40s, they become 45.
And I had people where I was looking at the age and I looked at the person and I thought, wow, this person looks not, they look way older than that. They look way younger than
There are a lot
that.
of
And I
things.
just thought, well, and then they clued me in. Just don't even look at the age.
well, and we did have several patients that, they didn't have a real bad problem, at least a couple that I saw, but they thought it was a big problem. And so going over the full physical exam and reassuring them that this is just a migraine headache, it's not a brain tumor, or it's just a pulled muscle, it's not a big spine tumor or some other thing. And then giving them something simple like ibuprofen or Tylenol. I had one patient who I gave her a prescription for ibuprofen and she blessed me twice. She went down to the pharmacy, got the prescription, came back up, back in the room with another patient in there, blessed me again, and then left. And so the gratefulness is unbelievable. And people are extremely resilient here. It's amazing what they've been living with. And sometimes not only the physical things, but the mental strain of it might be something bad, and I think we provided a little bit of relief, but also a little bit of just reassurance too.
Yeah.
We have a couple of questions and then we'll close up. We have 5 minutes left. For the doctors, what surprised you the most or how will this impact your work in the future?
So for me, I think in the future, how this would impact me, this is a very different way of practicing medicine here. The accessibility of all the different tests and scans and imaging that we have in the United States is wildly more extensive than they have here. Some of the very basic tests that I assumed everyone would have, they have to go to a different facility to even get the blood drawn and get the lab done. So for me, it's learning a lot more and focusing on the symptomatology, the history, everything that's going on with the patient, and maybe realizing we don't need to order all of the tests that we do. And while it's helpful and it's nice, it makes our job a lot easier. But they're still doing that here without all of those resources. And so kind of helping not only with their system here, but ours kind of going forward on reducing costs and kind of what we deem necessary.
I think one thing that I don't know if it surprised me, but it definitely really hit me was in the United States now for the last few years, we've been talking about the social determinants of health in our own communities of just, people can't get to a grocery store to buy vegetables, they won't eat vegetables, those sorts of things. And the biggest social determinant of health that, like, as I see the community and watch the community, I think is the water. And, the people here before a few years ago, there was no water well. And, all of these, people are still coming in with back pain and back strain because of all the things that they carry. But just the stories of how many hours per day elderly women and children had to spend just carrying water instead of going to school. Just, these things that like we just take for granted, just turning on a water faucet. And so, I know Sam was really instrumental in getting water to this community. And I can only just imagine what it was like before compared to what it's like now and how much that has really impacted the community.
Yeah, it was 2 places. It was in the community, right at the community center. There's water there, and we saw that people were pulling up, filling up. They bring their donkey with big carts of water and take off, and other people be carrying. But right in the community, everyone has fresh water there, and at the health center, there's now fresh water, all because of InSam. And I can't even imagine running a health center without fresh water. I just cannot believe it. And that's only been a couple of years. It's just unbelievable to me, like fresh water at both places has done more for health than anything doctors can do.
Yeah, I agree.
Just curious, so we landed, they landed Sunday morning, I landed yesterday morning. And we haven't gone into the dump site itself. We have a full schedule. We walked here to the community center yesterday, you turn that corner and you look up and you see what looks like to be a mountain, and then you realize it's a mountain of trash, right? And then you see, huge birds and people both on the rise, and it's hard to tell which is the animal. What was that like for you seeing it? Just kind of curious.
I took a picture. I thought a lot of them were birds, and I focused in. I just couldn't believe there was just hundreds of people up there, and a lot of them are focused around where the new trash is being dumped. They're waiting, and it's like a rush in, and just the danger involved with all that, and hearing the stories from the scholars about how dangerous that is, and how it's just, it almost makes me cry to think about going there for food every day, and then like you're going to a restaurant, and then going out about your chores, and then coming back at the end of the day to get more food. I am just so it's just hit my heart.
But also the idea that at a certain point, for some people, it's a life they get sucked into and almost trapped into, and almost like somebody who used the word addicted to that life and can't get out of it. And so that really struck me, that the earlier that you intervene in somebody's life who's kind of getting pulled into that cycle, the easier it will be to get them on a different path and to allow them to take a different path so that they aren't pulled to that one.
I'll end with a quick story about Miss Layla and her husband Berzu. We were just in their home when you guys were at the hospital. Miss Layla lost one leg early in life, so she's on prosthetic. A few weeks ago, her other leg was broken, and so we went to visit her. Every time I come, we all stay in the home with Miss Layla and Berzu. They're such an amazing couple. They have 2 children, and both scholars. And when Miss Layla was at the hospital, she said the doctor was asking her about her life. She, I have a daughter and a son. Oh, what's your daughter do? Oh, she's getting a master's in chemistry. And she said this doctor just couldn't believe it. Like, he was looking at me like, I see who you are. I know your life story. How is this possible? And she said, and he just couldn't, and I kept telling him, pay attention to my leg. I got home and it was so bad. I felt like he left the scissors in me. But it's just exciting to hear the stories from the parents of what this means. And summary, when you said, I want to give witness to what International Samaritan does, I just want to close out by saying International Samaritan isn't, it's an organization, but it's an organization made up of people, right? So the people include Andrew, who's led our work for 17 years, and has recruited and found team leaders like Salam T and Salam Kassan, leading our work all across the nation. It's made up of people like you who give an automatic $100 gets deposited a month. You know how much that means to be able to feed kids a $100 a month food basket because you give $100 a month? It means the world. It means people who stop busy lives and take a week to do this, to build a collaboration that's going to give life and save lives for years to come. And it's made up of our amazing scholars. You and 899 other young people like you who are amazing challenges to live amazing lives. And one thing I know is every single one of our scholars wants to find out how to give back. And so we're building scholars. We call them Samaritans for life. People who love God with their whole heart, whole mind, soul, and body, who love their neighbor like Jesus loved them, and they're going to raise their family to do the same. So we thank the Lord for bringing us all together. And I don't know if you guys have any closing comments, but that is who International Samaritan is. People called by the Lord to love and serve Him and each other. And we're just very grateful for you taking the time and for you doctors building this collaboration.
Thank you so much, guys, for joining us here and taking this time to spend time with us here in Ethiopia. We hope that you've learned something. We thank you so much for walking hand in hand with us as we walk with these beautiful communities that we love our job, we love our mission, and it's because of all people like who have big hearts. So God bless you, God bless your day, and thank you all.